When heavy monsoons recede, they leave behind a chaotic, waterlogged environment. Civilians are often forced to navigate submerged streets and knee-deep puddles just to go about their daily lives. But these stagnant pools hold an unseen threat. Rats and livestock urinate in these floodwaters, shedding bacteria and turning everyday city streets into massive reservoirs for infection. The pathogen responsible is Leptospira, a highly motile, tightly coiled bacteria known as a spirochete. Its shape dictates its mechanism of entry. When contaminated water splashes against a human host, these bacteria actively corkscrew their way through microscopic cuts in the skin or through the mucous membranes of the eyes and mouth. Simply walking through a residual flood puddle can unknowingly initiate a systemic infection, moving the organisms from the environment into the human circulatory system within minutes. For our patient, Arav, the clock starts ticking the moment he steps out of the water. 10 days later, the incubation period ends, triggering the sudden onset of the acute septicemic phase. The initial symptoms are aggressive, but incredibly generic. Arav is hit with an abrupt spiking fever, a severe headache, and intense, debilitating muscle pain in his legs and lower back. His eyes also become severely red and inflamed. This condition, called conjunctival suffusion, is unique because it occurs without any pus or purulent discharge. This presentation creates a medical trap. Local clinics see this constellation of symptoms constantly and often misdiagnose it as an endemic viral infection like dengue fever or a severe flu. The true bacterial identity of the pathogen remains hidden behind this viral mask, delaying the administration of the specific antibiotics needed to stop it. A few days later, the fever breaks. Arav feels better, and the bacteria seemingly vanish from his bloodstream. This deceptive retreat marks the immune phase. The bacteria abandon the blood, entrenching deep inside the kidneys and liver. Here, Leptospira attacks the endothelial lining of small blood vessels. As the vessel wall breaks apart, internal leakage spills fluid into surrounding tissue, causing ischemic damage. Arav's few days of improvement was actually the pathogen positioning itself for a catastrophic systemic attack. In about 10% of patients, this damage triggers a severe progression known as Weil's disease. The hepatic system begins to fail rapidly. Arav develops extreme jaundice, sharp pain in his right upper abdomen, and an enlarged liver. The failures cascade. His kidneys shut down, and he begins to exhibit hemorrhagic manifestations, including coughing up blood from his compromised lungs. In the emergency room, it becomes a race against time. Doctors must rapidly perform MAT testing, or PCR, to isolate the Leptospira DNA and rule out other viral hemorrhagic fevers. Without immediate targeted medical intervention, this multi-organ failure leads to fatal vascular collapse. The life-saving treatment requires the immediate administration of high-dose intravenous penicillin G, or ceftriaxone. These specific antibiotics systematically neutralize the spirochetes within the tissues, which allows the endothelial lining to stabilize and halts the leakage. Slowly, the liver and kidney functions begin to normalize. Arav achieves stabilization and begins his recovery in the hospital ward. The human body can reverse the systemic attack, but only if the correct chemical reinforcements arrive before irreversible tissue death occurs. Zooming out from a single patient, the global reality is staggering. Leptospirosis causes over 1 million infections and nearly 60,000 deaths every year. Rising temperatures and heavier monsoons are expanding the pathogen's reach, especially in regions with extreme agricultural flooding. Prevention relies on strict rodent control, wearing protective clothing, and absolute avoidance of stagnant floodwaters. Humanity cannot stop the rains from falling, but recognizing this mimics two-stage pattern early ensures that the right antibiotics are administered while the infection is still reversible.